Hi everyone, myself Dr. Maddineni Srinivas, dermatologist from Bharat. So in this video, we are going to see all the important frequently asked questions and queries related to the preparation of Plab examination. And here I have with me Dr. Devendra Sai Kumar. Heartiest congratulations
Hello,
first of
sir.
all on securing awesome score in the FMG examination recently.
Thank you, sir. Thank you very much.
We shall try to cover all the important points which are
Okay,
related
sir.
to
Definitely.
lab examination.
Definitely, sir.
Okay. So first, if I want to ask you the question, so first of all, why did you want to do the lab after you have completed MBBS from Davao Institute from Philippines?
Yes, sir. Yes, sir. So, during usually what happens is for foreign medical graduates, they have to do the FMG exam after coming to India, and then they just go through the regular pathway. And even for students who have an aspiration to go abroad, what they do is they just choose their options. There is Australia, USMLE, PLAB, or whatever. So for me, I did my intermediate also abroad because my parents were working there back then. So I had some issues with my grade 12, this equivalency things and all these things. I had a lot of issues with my small technical issues with my certifications. So I thought like, why not just try to go to a different country where it'll be better kind of a thing. That was the thought process. And UK was the first thing that came to my mind because I'd been seeing like UK doctors for a very long time. And then my parents also were like, yeah, why not you just try to go to the UK? And during my final year, I kind of learned through how to plan my way. And I met a few friends who are also aspiring to go to the UK. And that kind of helped me also just to kind of just fix it, you know. The plan was fixed from then on. I had a group of friends who were like going to join internship with me. They were also planning to UK, and then I was just ready to go from then on.
So
Yeah.
basically, you are having this plan while you are doing the graduation itself. So,
Yes, sir. Just before my graduation, I had this plan. Yeah.
oh, great, great. So
Yeah.
clarity of thought. Okay.
Yes, sir.
Right. So for Indian or international medical graduate, what is the complete pathway to practice in the UK through the PLAB? Can you briefly explain regarding this?
Yes, sir. So PLAB is basically a licensure exam which has two steps, step one and step two. And it is essentially for graduates who have not done their like degree, primary medical qualification in the UK. For anyone who has done their primary medical qualification outside the UK, for them to get a license to practice in the UK with a full GMC registration, they have to go through the PLAB pathway. I'm sure that there are other pathways also. Like if you do the Royal Colleges exams, also there's one way of getting a license. I'm not pretty sure about that, the technicals of it, but this is one of the easier ways and straightforward ways of doing it. And essentially, anyone can apply for the PLAB exam given you have graduated. That's the main criteria. The second thing is you need to have finished at least one of these linguistic tests, OET or IELTS. For IELTS, I personally did IELTS because my parents, before when they were working abroad, they did IELTS for various reasons. So I had an idea of how IELTS works. So I personally did IELTS, and the qualification, the minimum requirement was overall score of around 7, overall score of 7.5, but you need to get 7 in at least all the modules, not less than 7. Like speaking, you need to get at least 7, reading, writings, at least 7, but the overall score should be 7.5. That was the qualification, like minimum requirement for you to be able to eligible to apply for the exam itself. So these two are the prerequisites. And then you can apply for the exam. Once you have these two, you can look at when the dates are available. A PLAB one is conducted 4 times a year, and you can just book your exam accordingly, like plan like your preparation time and just book it accordingly.
Okay. Okay.
And yes, sir.
Yeah,
Yeah.
please tell, sir.
Yes. So when someone completes their PLAB one, they'll just get their results within like around 45 days. They'll just give a date when the exam will be conducted and when the results will be announced. Also, will be just the schedule will be announced 1 year ahead of time actually. And then from the next day itself, you can book your PLAB 2 exam. After having cleared, if people are very successful in clearing this PLAB 2 exam, they can apply for their registration as like immediately from then on, as soon as the results are released. And that will take about 2 to 3 weeks, given you have everything like the documentation, and given there's this verification of your medical qualification called the epic verification should be done. And once that is done and you have all these things in line, it's a straightforward process. It won't even take time. Mine just took about a month because I had small technical documents that I needed to get about my internship and all that. But other students just got it even before me, like 2 to 3 weeks. And once you get your GMC registration, it's a matter of applying for jobs. And before it was easier, it's getting difficult now. And from this year onwards, it's even more difficult given their policies with regards to foreign medical graduates. Yeah.
Okay, okay. So basically, who exactly is eligible to take the PLAB route? So you have already answered this. All the
Yes, sir.
non-UK graduates,
Yes, sir.
they
Yes,
are
sir.
all eligible, right?
Yes, sir.
Right. And can final year MBBS student start planning for PLAB? And at what stage is it ideal to begin the preparation for the PLAB exam?
Yes. Just one more thing about the eligibility thing. They have a list of colleges. I'm sure like most colleges are recognized by the NHS, the GMC people. But I heard that some colleges are not recognized because of various problems or whatever. But other than that, most colleges should be accepted by the GMC guidelines. They have a list of colleges, and most probably your college will be found over there. And people who have a doubt can just find their college in the inventory, whether it's recognized or not, just for just confirmation purposes. Yeah. Other than that, y- like my friends have prepared through internship. They've given their exam during internship. Because in the Philippines, graduation is before the internship. You get your primary, you get your degree, and internship is a whole different thing. 4 years of medicine, you graduate, then 1 year of internship is a complete separate thing. So, in graduation in itself is enough to apply for the PLAB exam. My friends have done it through the internship, but I have completed my internship and then prepared for it after coming back to India. I personally took 5 months. My friends were able to do it in three. I took 5 months because I was just confused and jumbled with regards to the preparation material. There are many out there, and of course, everybody had their own, like inputs. Like a couple of my friends who did it before me, this one is better, the other one was better. But I took time for me to figure out what was the best for me, and that's one is what I would recommend to anyone who is watching right now. But essentially, it will take like 3 to 4 months is more than enough for PLAB one, and 2 to 3 months for PLAB is also very much enough. 2 to 3 months, like, and in between 2 months of break, for example, for the results to come. And once the results have come, to process your visa, you just need to take at least a month to process your documents, your visa, and your accommodation. And then another preparation time of around 2 to 3 months will be more than enough. So you can plan this around a 9 months timeline will be good enough. Yeah.
Okay, okay. So what are the present eligibility requirements that you have just now told? Is there any like important recent change which was done by the GMC for the eligibility of this PLAB exam?
Actually, the Plab exam does not have any changes in regards to the eligibility, sir. It's just the same thing. They've changed the name of it to UKMLA, but I don't think that's much of a difference because it's just the name that has been changed. Because I was the first person, like the people who did the exam with me, were the people who did the actual UKMLA kind of a thing. But it's not that much of a difference. It's just a change in name. That's the only difference that I can notice.
Oh, is it Dr. Sai? Previously, I heard that UK PLAB exam was for the international students and UK MLA was the medical licensing assessment exam was for the UK graduates. So now they have we
That
can.
is the idea, sir. I don't know whether it has been whether locals are supposed to do it yet, but that's the idea. They changed the PLAB to UKMLA so that the UK graduates are also supposed to do it, but I don't think that has been implemented yet. Like the local graduates, as far as I know, they have not done the exam yet. It's for now. It's only for the graduates who have done it outside. Yeah.
Oh, okay, okay.
Yes, sir.
So you have told about the English proficiency examination. So you felt
Yes, sir.
IELTS was better than OET. So you took that path. Okay,
Myself, sir. Yes.
yourself.
But
Okay.
most of my friends who graduated here have done OET. They said it was much easier. especially the written part. The writing is where most people struggle in IELTS, which my friends told me was more easier to do it in OET because it's more like a prescription kind of a thing where it's much more medical oriented kind of an exam. Apparently, the OET is more like history taking. The speaking part is also more like history taking, and the listening is also like writing about the consultation and how you do it with the patient kind of a thing. So though they told me that that would be easier, but for myself, I personally did IELTS.
Anything you used as a resource to prepare for the IELTS or?
Yes, sir. So online you would find a lot of Cambridge materials. Cambridge, I have done almost like practice from those Cambridge books itself. I have not subscribed or took any kind of coaching for that. Uh, the only coaching you would need is all there on YouTube. Like a lot of people like E2 Learning. There are a lot of people who just teach IELTS online. They just give a basic idea, and all the candidate needs to do is just practice from the official Cambridge books, not anything else. IDP or Cambridge are the two main sources. They have a lot of books from a very long time. Like the current edition is Cambridge 20 of IELTS. They have practice modules for all the four: speaking, reading, writing, and listening. So you can just do those and just go back through all the modules like as much as you can and just appear for it. People where people usually where I have struggled personally is writing. And some people, like for example, as Indians, since we do not have more exposure to speaking with other people in English, that's where some of us struggle. But for me, it was writing. But yeah, we can just go through it like with a bit of a practice. It's not that hard. Otherwise, people can go with OET also.
Great, great. Okay.
Yes, sir.
So Dr. Sai, can you explain the structure of the PLAB one, including how many number of questions are there? What is the exam pattern? What is the duration and type of the clinical thinking, which basically the PLAB one tests?
Yes, sir. So essentially, Plab 1 is a 180 marks questions test paper. When I did the exam, it was paper based. I heard that they were going to change it to computer based sooner, but when I did it, it was still paper based. And a couple of years later, also when my friends did it 1.5 year, 2 years after me, they were also just doing the paper based lab one exam. So it's 180 questions. It's mostly revolved around the fourth year subjects: medicine, surgery, pediatrics, a bit of derma, opta, and a bit of ENT and psychiatry. But the bulk of the questions will be from medicine, cardiology, neurology, pulmonology, a bit of OB-GYN as well, and pediatrics. And the questions will be very clinically based. Uh, Either they'll give a case and they'll ask you to diagnose it, or the first line, second line of investigations, or just the treatment. It won't be very hard. It won't be that easy as well. And the stems will be quite lengthy. It won't be one-liners more for the most part. And all the questions will be case based, sir. Like it'll be a case and you'll have to diagnose it. The case won't be very long if you are able to approach the question in a way that you're supposed to, like, see what they're actually trying to ask and not get distracted with the whole stem. It will be easy to just go through it. The hard part is managing the time, because you have to read the stem, answer it, and you have just 1 minute to do this exam. Like it's 180 questions. 180 questions and 180 minutes to do it. That's the challenge. And the problem is you have to do the marking on the paper, the OMR sheet. That was the hard part for me. You have to read it, answer it, and then mark it. And then if you make a mistake in marking the OMR, it will be very hard. You just need to erase everything and then just go from the start. So we need to be actually careful there. Apart from that, it won't be that hard, sir.
Very interesting because in India we are actually following the computer-based test and still.
Yes, sir.
So what is the year you have given the PLAB one, Dr. Sai?
I have done it around 2024 August, 8th of August 2024.
Okay, but still it is paper-based. It is very
Yes,
surprised.
sir. Yes, sir. Actually, it is. Yeah.
Right. So now can you explain the PLAB 2 in detail, like practicals, how what stations, how many stations will be there? Doctors themselves, are they going to be acting as patients? What will be the case? Can you please explain?
So Plab 2, sir, it's actually, I wouldn't say it's a real exam kind of a thing. It's more like they're going to test your consultation skills. That's what they prioritize, and that's the most emphasis that they give towards. It's not actually how much knowledge you have. It's more like whether you will fit into their system or that's what they're trying to test. From whatever I have seen in the UK, I've stayed in the UK for 6 months and then did this exam. They are more revolved around how you approach the patient rather than your actual knowledge. They're of the idea and concept that the knowledge that you will gain will come through time, like with your training. And the training is quite long, and they are of the belief that it will come eventually. But what they give to emphasis towards is more like patient-centered treatment, how you approach, how you speak to the patient, kind of like not hurting their feelings, kind of thing. It's more revolved around that rather than the actual treatment. And because this exam is mostly for level of an FY2, which is just basically graduate, a person who has graduated, they do not expect you to have so much responsibilities. This Plab 2 exam is also based on that. How much how much you know, how much responsibility you can take, and how much you're not supposed to take, and how much you and when you will escalate it to the appropriate person, and whether you'll follow the guidelines and the protocols and the channels of escalation. That's what they're trying to test essentially, and how you speak to the patient. Of course, you will have to diagnose the case, you'll have to manage it, but the management will should be according to your level of an FY2 as a junior doctor, not the level of a consultant and beyond that. That's not what they're looking forward to. And there are 16 stations to this exam. And 16 stations, you will definitely, everyone has to do a prescription station. The prescription uh, pattern in the UK is not as simple as just writing the drugs and then just giving it to the patient. It's very computer based, and then there are a lot of things that you have to do. There's a format for it, and they have a separate prescription pad that they give, and we have to fill in the details according to how we learned the UK way, the NHS way. And it's different. It's different from trust to trust, but the Plab exam tests the general way of doing a prescription in the UK. It's just the same thing, but they have a format, and you need to fill it in the right boxes, right places, put your sign in the right place, your registration in the right place, and all these things. And there is a station where there'll be dummy uh, mannequin. There'll be different cases. It'll be kind of emergency dealing kind of thing. It'll be acute exacerbation of COPD, asthma, anaphylaxis. It could be bleeding on warfarin or whatever. There are like 15 to 20 cases that are a stock, and most of the that particular station case will come from those 15 to 16 cases only. But they might, on an odd day, and if we're not lucky, they might go out of those 15 to 20 cases bracket. They might give you something new. And even the prescriptions also, it's like very general. They'll have like a standard 15 to 20 prescriptions that they'll test you on, and they'll just ask you to just do one of those in the exam. It's a race against time, sir, like when you're doing these things. And the rest of the stations, they might test you on skills like venipuncture or ABG taking. Apart from that, the rest around 12 to 13 stations will definitely be around talking to the patient, managing the patient, and kind of taking history. There'll be around 12 stations like that. Overall, 16 stations.
Okay. Okay. So how is PLAB different from USMLE exam? So many students also might be thinking of USMLE. So can you briefly tell any differences are there between these two exams?
Yes, sir. I'm not really sure about how much the USMLE is and how far it goes, but I've talked to a few people who have done the USMLE. Essentially, one difference is the UK, the PLAB or the UKMLA is the 2 steps. That's 3 steps. And the second thing is you need to have graduated medicine to even be eligible for the PLAB exam. But USMLE, I think you can just do it through your medicine. And there is these things called matching once you are done with the 3 steps of USMLE. And that requires a good portfolio. And from there, it might be a hit or miss. Like people who have a really good portfolio and how much they present themselves during their observership there in the US have a better chance. And I've seen a lot of people struggling to make it through the matching process after having invested a lot of time and even completing the 3 steps. But I've seen a lot of like friends of mine also making it like in their first year itself after completing 3 steps straightforward, entering the US system. And the other thing is, I think USMLE, I think you just get matched into a specialization of your choice or specialization that gets you in, like depending on your marks or whatever. But PLAB is just a licensure exam. once you complete your license, you need to do some kind of a job out there, build a portfolio, and then apply for the specialty of your choice. It's not like they will match you. It's really up to you. You can work as a junior doctor if you are aspiring to go into medicine. Just build a portfolio that fits the medicine. They give like a requirements and they have points for that, and you need to complete all the requirements and then apply, which will be in September. Usually for like medicine training will be in September, October. They open a window where you can apply. The same goes for surgery, derma, whatever. You need to build a portfolio, submit it, and once your portfolio gets picked, they'll do an interview. There'll be a lot of competition for it. But if you're able to present yourself, you can get in. Once you get in, it'll be very easy just to go through the rest of the training. The
Oh,
structure will be okay. Yes, sir.
that's a very valuable insight, Dr. Sai. Right, got it. And having done FMG as well as PLAB,
Yes, sir.
so what is the advisable strategy for those students who are willing to do practice in India or in the UK? They are confused. So what would be the better strategy according to you, Dr. Sai?
Personally, I had issues. That's why I was not able to do the FMG initially. But what I've always told my friends who have asked me whether they should do the FMG first or whatever, I always told them, and even now also, I'm of the personal choice and strong belief that if you do your medicine outside, the first and main thing you should do, first thing, get your FMG done with, get your license in India, and then do whatever you want. Like if you want to go to the UK, US, Australia, spend how much time you want, how much ever money you want, you can invest anything later. But the main important thing is just get your FMG done with, get your license. And then once this will act like a question, sir. Like if somebody throws us out, like eventually, because a lot of anti-immigration thing is going on all around the world, or if you're not just suitable for working over there, any issues that you have, you can just come back, fall back to India, and you can just survive here. But without the FMG, it will become very hard for anyone to just, it will be like throwing stones into the dark and you don't know whether it'll hit or miss. So, my suggestion always just come home, prepare for 4 months, 5 months, get your FMG done with, get your license. If you're just, they ask you to do your internship, get your license, and then do whatever you want. Like if you want to go for NEET, aims, like or abroad, just do those after completing your FMG. That's my very strong recommendation, sir. Like, yeah.
Okay, great. And how did you feel about the difficulty level of these two exams, FMG and PLAB?
I felt the FMG was a much harder exam given the quantum of the syllabus, sir. Like the PLAB initially at that time, it was not very easy for me. But there was, in retrospect, if I had to redo my preparation and be prepared in such a way that I needed to, I would have done better. It would have made it easier for me. But I was not able to plan properly. That's why I just barely passed that exam. But the FMG, I think it's harder exam, but because the FMG has your first year subjects, second year subjects, and also subjects that I would have not have studied abroad, like PSM, forensic. These subjects I have not done like according to the Indian standards. So that because the community medicine, family medicine thing in the Philippines is completely different to how it is in India. And just based on the sheer syllabus, I think FMG is a much harder exam in even in terms of the depth of the questions asked. I don't know, like because I've seen YouTube videos of like doctors talking about the hardness of the exam and whether licensure exam is supposed to be that hard or not. Given I have done another licensure exam, the FMG is much harder than that. That's what I would say, sir. Definitely.
Okay, and
Yeah.
I'm very glad that you have cleared the both the exams. Right.
Thank you, sir.
Uh, how should beginners plan their preparation for PLAB 1, PLAB 2? How many months of study is usually enough? So just briefly, you can mention
Yes,
and.
sir. So there are a lot of platforms, sir. If you want to prepare for PLAB, right? I've taken all the platforms, which was a waste of time and money. If I would recommend it to anyone, I would just say take a question bank called Plavable. It is very concise, very oriented. And if people are able to do the question bank with the explanation, they have study material also in terms of PPTs and flashcards. If you just do the flashcards, do all the questions, do them twice, you can just reset it and do it twice. I think that will be like more than enough to clear the exam in like 3 months, 3.5 months. I, at the end, stuck with that, like the last 2 months. That was what I went to at the end. And as I said, sir, the Plab 1 exam is not a very, very hard, like in-depth kind of question. So you can just do with the basics and you can just clear the exam. If you can do the Plabable question bank and just read whatever the knowledge, whatever the like flashcard they have and do a couple of mocks, it is a doable exam. And the topics are quite repeated in Plab 1 exam as well. And 3 months is quite sufficient. I would recommend Plabable because that's what I have stuck with and that's what gave me the result that I got. And for my friends who have scored more than me also, they stuck with Plabable as well. So I would recommend that. Yeah.
Okay, okay. What are the common mistakes which PLAB aspirants make during their preparation, and how can they avoid wasting time or money?
Yes, sir. So this one, the preparation material, people end up taking a lot of things and then they end up studying all of those, which is really not necessary. And then it becomes a lot at the end. Either they just make it through or sometimes they just don't make it, and that's the problem with picking the material. And I think just if you follow the question bank and see how the questions are structured, it's quite a doable exam. And the Plab one is just a straightforward exam, so you just study, clear it. But the problem comes, and the exam in itself, compared to the other countries' licensure exams, is not that expensive, just 28 or 30,000 rupees. The
Oh,
Australian exams, the USM exams are just 1 lakh starting the first step itself. The problem comes when you go to the UK and for PLAB 2. That's where the pressure comes in. That's where people make a lot of mistakes. That's where a lot of people fail. And that makes a huge impact because not being able to do a theory exam here, it will affect you, but not to an extent where you go to the UK, spend a lot of money, prepare there, and then the PLAB 2 exam is 1 lakh 15, 1 lakh 10. I think that exam will have a bigger impact on the mind. So that's where lot of people fail the exam and not clear it through. And a lot of people end up giving up after having spent a lot of time and investing a lot of effort and energy into it. I would
oh.
say it's mostly about practice Plab too and taking the right source. People have cleared it without taking any academy support. They were able to make it. Congratulations to them. But I would always recommend people to take an academy, go there, practice with other people, find a partner or a couple of partners, try to practice these consultation cases every day. It's basically each station is 8 minutes, and you have to take history, counsel the patient, manage the patient, all these things, and order labs and whatever is required within those 8 minutes. So it's just a matter of practice. With practice, people can get it through. And on the day, how you are feeling is also a big thing. And the big misconception is the Plab 2 cases, what comes in the exam, they might come randomly. They don't come randomly. So there are a set of cases, like 500 or 1,000 scenarios that are already there, and those cases kind of repeat. But for some unfortunate reason, just people just say, oh, it just comes randomly and you need to be ready for anything. It's not like that. There's a structure, and the platform that you take. I have taken a course called Low Ones. Like, he's a guy who kind of just broke down these things and kind of explained that, the cases are going to come like this and you need to approach it like
Can
this.
you spell it out, Dr. Sai? What is the name?
Lowan, Loovan. Lowan. He's a guy. He's a doctor over there. It's a 5-day course, and it's not that expensive. Also, it's 10,000. So given the other academies charge around 50,000, but this guy just makes it very easy. And almost everybody who does the Plab exam just takes his course. People who don't know it, kind of, it's unfortunate for them because he teaches them. And for me, what he taught exactly came in the exam. Like, literally, the questions they asked, the type of response I gave, it was kind of very similar. So I would say take that course and then along with some other academy if you can, try to practice with other people as well. And from there on, it's doable, sir. And then it's just a matter of how you present on the day. Yeah,
Okay.
that's about it.
So just in one word, how much was the total expenses for the entire PLAB 1, PLAB 2, including the stay and everything?
So it really, really depends. People have done it, uh, like
So just
cheaper
for
than
you, how
half.
much did it cost when you did?
Around 10, around 10 to 12 it has costed me, sir. 10 to 12. Because I stayed in the UK for 6 months. And that was the bulk of the expenditure because it
So
costed me around 70 to 80.
rather than the exams, the stay is the one which is very
Yes,
cost.
Yes, sir, that's the problem because the rent is usually 500 to 600 pound a month, which is
Oh,
like 70,000 Indian rupees, and then the food expenses, the travel expense, so there will account for another 20 to 30,000 a month. So that will bulk of the expense. Other than that, the exam in itself is 1 lakh, and then this Plab one is 30,000. The preparation, like the coaching, will be around 50 or 60. And for Plab one, the Plabable question bank 6 months is just like 7,000 or 8,000, sir. So that won't be a big issue. So if you just say 2 lakhs for the actual exam and the academy, the stay over there will cost you more. I have done an ALS course over there that costed me around 600 pound again. That will be under like 70,000 rupees. And yeah, pretty much around 10 to 12, sir,
10 to 12 lakh.
essentially. Yes, sir.
Okay, okay. So just briefly about how to create and register the GMC account properly, and what are the documents which should be kept ready for the registration process.
Anyone can apply, anyone can create a GMC account. Literally anyone who has completed medicine can create a GMC account. They're not going to ask you for any proofs. They're not going to ask you to upload documents. You can just create a GMC account with your email, and you can just select your college name from the list of colleges that you have. But that's just the first step. But if you want to see the dates of Plab 1, Plab 2, when these exams are going to be even conducted, you need to have uploaded your IELTS or your OET. Then only you will be able to see when these Plab exams are going to be conducted. So once you upload your IELTS score and it's verified within a day or two, then you will be able to see when these exams are conducted and you can book it. But then once you clear these exams and once you know you'll pass the exam or whatever, before you get your GMC registration, you need to get your documents verified, your internship documents and your primary medical qualification documents with an institution called international institution called EPIC. That's what like everybody follows, like the US people, the UK, Australia. It's called EPIC. They just you have to just send them your documents. They'll verify the authenticity with your college, and they'll get back to you. They'll just make a video call, and you have to show them your passport. Just put your passport by your face, and then they'll just verify everything. And once that's done, the GMC people will just look at your degree and just know that it's valid, and they'll just go through with your process of giving your license.
Okay. And Dr. Sai,
Yes, sir.
what will be the salary expectation?
Usually, there are two things, sir. Like usually in the UK, after they finish their medicine, there'll be two things for foundation year one, foundation year two. Foundation year one is essentially when they have a temporary license. And once they're done with the foundation year one, they go to foundation year two, where they'll get their full registration, and they're actually proper junior doctors. So the FY1s won't get as much, but the FY2 salary, which we are also applying for after having completed internship and these Plab exams, that's the post we'll be applying for initially. And usually that salary will range from 2,800 pound to 3,500, 3,800 also, depending on the trust where you get your job. A couple of my friends get around 3,500, 3,400, around that range, so like the initial salary. And with experience, and if you get into training, your salary increases by around 500, 600 pounds like every year, depending on the year you're at with regards to your training.
So, Dr. Sai, the salary is going to be approximately in Indian terms, initially anywhere between 2 lakhs 50,000 to 3 lakhs 50,000 per month.
Yes, sir. And there will be about 20% tax. If you remove that, it'll you will get around 3,000, 3,200, 3,100, depends on how much your actual salary is, with a 20% of deduction to your hand. And that will be about it, sir. I think more than the salary in itself, the expenditure over there is a bit more, and it then really is up to you how your lifestyle is and how much you can save after that. The charges will be around 8 to 9,000. That won't be so much too much, but what they expect is a cover letter where you have to submit to the UK immigration people, and they'll ask you for a purpose why you're visiting that country. Of course, we're going there for the purpose of examination. There'll be special thing that you have to select for student examination. There's a separate sector where you can actually select. And what they're actually expecting you to do is to leave the country as soon as you're done with the exam. That's their expectation. But regardless, they'll just give you a visa of 6 months. And what we need to mention in the cover letter, we'll be leaving the country as soon as we're done with the exam, and will not be staying unnecessarily. That's what we need to make it clear to them. At least that's what we'll tell them. And ideally, we're supposed to do that. But we have other things to do, like an observership that I did for about 6 weeks. And I've also done my ALS course over there. And these kind of things, you need to stay over there to do them. So most probably people will extend their stay over there for at least 1 to 2 months after their exam. And they'll go to the UK at least 1 month before the exam. That's what most people do. Some people just show up to the exam, do it, get it done with, and go home. That's good from them. But usually, most people just go there 1 month ahead, get used to the place, get used to everything over there, and just go to the exam center, just see how things are going over there, and just get it done with. And the prerequisite for the visa is nothing much, sir. So, what they expect you to do is just tell them how much your accommodation costs, that you have actually booked an accommodation, and you have to show them your examination booking date. And you can also tell them, they might ask you why you are going 1 month ahead of time if your exam is just 1 month later. You need to tell them that you have a course that you need to attend, just a training of sort. You can just request a letter from your academy or whoever. They'll send it to you. You can just produce that to the embassy people. And once you are done with these things, they'll ask you to estimate how much it costs. You need to just mention in the cover letter. If it's going to cost you like £4,000 or £3,000, around 3 to 4 lakhs, you need to show them a statement, bank statement of three times more than that, around three times more than that. So if you are going to approximate around 3 to 4 lakhs, they might expect you to show around 8 to 10 lakhs in your account. If you're going to just tell them that, I'm going to finish everything in 2 lakhs, they might just expect you to just show around 5 to 6. And it really depends on how you're going to produce it on the cover letter that you're going to submit. And you can also produce additional documents, like if your parents are employed, you can show them the salary slip or evaluation of your property or house. Just show them that, I have these things. So just in case things go wrong, I can afford to get back to India on my own. That's the crux of the requirements. And the most important thing is, why people's visas get rejected is just the bank statement. If they're not able to show enough funds, that's the one of the main reasons why your visa will be rejected. Other than that, they don't have a reason to actually cancel your or not give your visa on time. And the process will take about 1 week, 10 days max, like max 2 weeks. That it won't take more than that. You need to show up at the VFS office, like wherever, in whichever city that you are, and just take a photo and put your fingerprint. Pay them around 2,500 extra for some reason, and then that's it. That will be your visa process, sir. Nothing much more than that. They'll give
Great.
you a 6 months visa. You can plan your stay accordingly, do the exam. People just struggle to get clinical attachments or observerships over there, but if you plan that ahead of time, it will be very good, so that you won't have to go to the UK and then start searching over there, because it will just be a waste of time and money. And if you can do that ahead of time, it will be much better. You can save around 1 or 2 months. Yes, sir.
Okay. Lifestyle of a doctor in the UK, like in the early years, including the workload, the training environment.
So that's a very broad concept, sir. But one thing I can definitely tell you is, like, I've been in Manchester. I've been to a lot of hospitals in Manchester. One thing I can tell you is there are more colored people, Asians, and like Asian people, people of color in the UK than the actual white British people. You will see more of our people, Desi people, than the UK people itself. So people are actually habituated, but some people might not be as receptive or as more accepting. But the UK guidelines, NHS guidelines are very clear regarding racist behavior from the side of doctors and patients. Patients can reject treatment in itself, but they cannot reject who is providing the treatment. So if they are willing to receive the treatment, it can be from anyone. And if their basis of not receiving treatment is because a doctor is not a UK or a white person or whatever, it's not valid, and you will be protected. But from whatever I have seen over there, and the people over there, the patients or the doctors are usually blended with a lot of nationalities. So I don't think that will be much of a problem. There will be definitely cases here and there where people might not be as welcoming, but there are guidelines and you will be protected by the NHS. And the other thing is like people in the higher positions, the head of department, senior consultants, you can definitely find Indians, Pakistanis, Chinese, like Africans, people from all over the world. So I think that will be covered for certain. That won't be a big issue over there. Yeah.
Okay, Dr. Sai. And can you just tell what is the reason for your preference of FMG and settling in India rather than the plan which you previously planned? What was the reason for changes in the plans?
So first thing, sir, like plan to go over there was more of like issues with the documentation mainly. And the second thing was the work-life balance over there is just fantastic, sir. Just it's so nice. First of all, it's a government setup, the NHS. If you get a job in the NHS, the treatment over there for anyone is free. And of course, like the type of technology they use, the advancements in medical system over there is really fantastic. The way they go through the process is nice. And the work for junior doctors is like it ranges from either 8 hours or 12 hours max. That's the most you have to do, even when you're training as a surgery resident, a medicine resident, radiology resident, whatever residence you're doing, it's just 8 hours or 12 hours. And anything more than that, you'll be paid extra. And which, again, the NHS does not recommend because they just want you to have enough rest so that you can function efficiently the next day and the day after that. They have clear guidelines to how much you can work per week and how much you're not supposed to work beyond which point. If you have done a shift of 12 hours, they really do not encourage you to stay for another 2 hours, even if uh, required kind of a thing. They'll just try to find other people who will do the work for you instead of you staying under 2 hours or 3 hours to get things done. And so that's the work-life balance. And then you always get weekends off. And if they're expecting you to work on a weekend, you'll get paid extra. So these are the kind of benefits of working there in the NHS setup. And of course, exposure to a lot of people, different cultures, and kind of since I am an FMG, like stayed outside India, the culture is a bit different to how it is here. It will be very similar and very open out there in in Europe, in the UK. But me personally, I always wanted to work in India. Like because if I had not had other issues like with my grade 12 and all these things, I would have definitely come to India first and then seen like how it is over here and then decided. But then once this year when they implemented the UK prioritization bill, which was something an issue that had been being discussed for about like 3 to 4 years now. They just want to prioritize UK graduates over like foreign medical graduates because the graduates in the UK, they're really good in terms of knowledge, in terms of competitive spirit. But then it came to a point where like people from outside started taking over, kind of a thing. That was the feeling, at least for the UK people. And eventually, they just implemented that bill saying that even in training, even whatever we're going to do, we're going to first see the UK graduates, and then the remaining spots, if they're left at all, those will be for the how many n number of foreign graduates who have traveled to the UK, that will be distributed among them. That was the point where I realized that it was not going to work for me over there because I have a friend who is really a genius, who was able to clear Plab 1, Plab 2 within a span of like very short time, done his MRCP Part 1, Part 2 in a span of like 4 to 5 months, and done all his competencies and submitted his medicine portfolio, but was not still able to get through the training pathway because of the UK prioritization bill, although he did really well in the interview. And that was when I realized, no, that's you just need to come back to the FMG thing. That's when I applied for the FMG and then just got to Cerebellum and just did it.
Do's and don'ts, which all the students who are watching this video must definitely know if they are only planning to take the PLAB exam.
First of all, people need to understand the situation over there and what they actually want to do right now, given what's going on over there in the UK, given the policies. And it is still possible to get a junior level job, junior doctor level job if they try. But then after that, whether you can go into training or not, it's really hard from whatever I have known. But some people are still willing to work in the UK as junior doctors, get that £3,500 and just stay there because they love the weather, the culture, and all those things. If that's the plan, that's okay. But if you just need to figure out what you want to achieve by going over there. If you just want to stay there, get a few bucks, stay there in another country, just get the exposure to the UK system, definitely you can go there. But if your plan is very long term, you just need to think twice before even starting out the journey. People are still doing the PLAB exam, and I hope that they'll get into training and later came to realize that the training thing is becoming harder, and even getting the junior level jobs is becoming harder by the day. It was not like it was a few years ago, because when I planned it, it was 2022, 2023. People were getting into the UK right, left, right, and center, because it was just after COVID, and UK just opened the doors for all immigrant doctors. But 2 to 3 years later, things got saturated. I wouldn't say saturated. People are still getting jobs, but it's getting tough. That's what I would say. And just people need to be aware of all these things before they even plan their journey, because there are a lot of other options also if they really want to work outside India. So just see their options and what they're actually willing to achieve. That's it. That's about it.
The next step, if I may ask, that is becoming really tough, I know, but so how to practice like specific radiology, general medicine, gynecology, dermatology after this junior doctor post?
Usually, how it is they have a specific window period where you have to submit your portfolio. Really depends. First, usually people clear these PLAB exams and do a 1 year of junior level job. If they manage to get into a, a kind of a job where you can rotate in between departments, it will be very much better. Or else you find a job where you want to get into specialty. Or for example, if you want to get into dermatology, find a junior level doctor job in a dermatology department, which will be easier if you get your first NHS job already. The second NHS job, you can apply in a derma department and try to finish all the competencies. There will be requirements for each department. Once you get those requirements done and try to publish a paper, a presentation, and all these things, you can just submit it during the window period. Once your portfolio or application gets accepted, there will be an interview process and a selection process. So once you get a good rank in the interview, which means they'll essentially test you on knowledge. They'll probably give you clinical scenarios where you'll have to answer, and also the way you answer it, how you will escalate it. As a junior doctor, they will again not expect you to act at the level of a consultant. For example, where people make mistakes is they just, because they have studied a lot or whatever, they know the treatment, they just go over and beyond when they're trying to answer questions. Those are kind of things they also look at. If you're a junior level doctor, they just expect you to stay at a certain level, and that's what they expect you to do at the level of an FI2 while you're working before. So these are things, and once they go through the interview process, if you get selected through that as well, they'll just select you and then they'll start your training. For surgery, medicine, it's usually 3 years of general training and then specialty training for another 3 years, and then working as a junior consultant. And as a consultant, the whole process will take about 8 years if you do get your things done neatly, properly, without any breaks. 10 to 12 years if there are breaks in between. And meanwhile, what they expect you to do is, before you finish your training, they will be expecting you to clear your Royal College exams. If you're in medicine, they'll be expecting you to complete your MRCP 3 steps before you finish your training, and something like that, sir. Just they'll be asking you to clear your exams. That's the process of becoming a consultant over there.
Okay, okay. Was a very detailed explanation about the entire PLAB examination and the
Yeah,
frequently asked questions which many students may be having in their mind. Um, Thank you so much, Dr. Sai.
it's okay, sir. Welcome.
Detailed explanation of all the important queries which students may be having regarding the PLAB examination. Which
Yeah,
area were you staying for the 6 months?
I stayed in Manchester, sir. It's also the place where the exams are conducted. I stayed in Manchester itself. I didn't travel anywhere
Manchester.
else. I worked in Department of Pediatric Surgery, and he was welcoming enough. He just took us to different places around Manchester, but I was not able to travel to London and all these places. I didn't have that much time.
Okay, so basically time crunch was there because you are obviously
100%.
preparing for the exam.
Yes, sir.
No.
Yes, sir.
So right, Dr. Sai, Thank you so much once again, and all the very best
Welcome,
for
sir.
your future endeavors. And welcome back to India with
Very
the
much, sir. Felt nice to come back actually.
with the FMG examination. So you are
Yes.
back again, and I wish that you are going to get a great work-life balance, which you wanted in the UK, in India itself.
Yes, sir.
So
Yeah.
Jai Bharat.
Yes, sir.
Uh,
Yeah.
so that's it in this video, dear students. If you are having any more queries, you can put your queries in the comment section. Dr. Sai is going to take some time and would definitely answer your queries. And if you want any more topics to be discussed, you can put in the comment section about the topic which you want me to make a video on. So that's it in this video, dear students. I hope it was helpful. If so, please do hit that like button and also do subscribe to my channel.